Hi everybody, I'm Dr. Qazi. I'm over in Newport Beach, California. I do a lot with skin restoration. I do a lot with acne and scars and pigmentation. And today I'm going to talk about a hot topic that really has been going really viral lately. I'm seeing a lot of it on my feed. I have a lot of questions all the time about this, and that's with PRP, what it's useful for, where do we place it, and if it could work for certain conditions. So I'm going to showcase the areas that I think it works best and kind of talk a little bit about why I don't do it for other treatments. For example, with scars, or even sometimes I've heard people do it for pigmentation. If you look at this right over here, this is from PRP, and during this discussion I'm going to walk you through the process of how I fix a patient's under eyes, whether that's with platelet-rich plasma, whether that's with filler, whether it's with laser. We could do multiple different modalities, even surgical if we need to. It just really depends on what's really happening over here. So during this process, this is our show. Basically, it's unsponsored, and we are able to be interactive with the audience. So I'm going to kind of talk and just kind of go through a few different things, especially with PRP. But like I said, I'll talk about also if you are curious about it for other subjects too, and then also like PRP for scars, which is a really hot topic. And I had some of our research coordinators really go through just some of the latest data about PRP with under eyes, as well as PRP for scars, and kind of just hopefully we could give you some better information about that. User is saying, where are you located? We're in Newport Beach, California, just about 5 minutes away from the airport there, the John Wayne Airport. So this is PRP right now. This is something that I think is was it was not talked about enough over the last few years, and then kind of the pendulum swung, and we're talking a lot about it again. And I really like that because it does work very, very well for the right skin condition. If you see for this patient, for example, I am going to probably just blow it up a little bit over here. So I'll show you really, really close, and you could be able to see just the skin quality, how improved it was. And with this patient, we did do 4 sessions, but you could take a look and see, look at that skin quality, look at those wrinkles. They've improved a lot. I'm going to try to make it just so it's a little bit more visible for you. You can see that really, really well right there, where the skin, it just, those fine lines have significantly improved. And what's interesting is actually, I've seen this patient for years and years, and the skin still looks great. She does do PRP every once a year, I would say, but it sort of depends on every single patient what they want to do and how often they want to do that. So this is really nice because we could essentially get the softening of the under eye area without volume, without doing filler, and really it's really nice because it's your own natural blood. You really aren't going to get an adverse reaction like filler, where sometimes filler draws in too much water. That's not going to happen with PRP. It's just basically what it is if someone's asking, what is it? It's platelet-rich plasma. So what we do is we get your blood, we spin it around, and then we separate your blood, and we get the growth factors, where the platelets are just full of all these nutrients and growth factors, and then we use those growth factors for areas like your under eyes or like your scalp, and that's basically what we end up doing to bring in some more blood flow there. So this is really, really nice because it's a process that over time is just going to get better and better too. It's just basically improving your natural skin quality. Really, really great. I think that, like I said, that it's something that not enough people were talking about over the last few years, and now kind of suddenly again everyone's talking about it. I know a lot of people talk about PRFM, and I see some questions about that right now. So I'll just say that myself, I never really noticed much of a difference between PRFM and PRP. It wasn't really anything that I noticed really, so I just go and use PRP at this point. I used to use a lot of PRFM. I was told that was superior. It turns out there was no real data showcasing that was superior or anything like that. It was just sort of just like what it was told. PRP works great, and it's not as expensive, and so why not just use your own blood and just naturally spin it around and just re-inject it in there. Our prices are on our website. So if you go to our website, drqazi.com, you could see almost all of our prices, other than a few procedures, which I would just have to see you in person for. But pretty much everything else is in person. And we do just try to make it as transparent and easy for people just to understand that. Minola saying, do you do any of dermal filler yourself? On myself, no, I haven't done it myself, but I have had other people put it in me. And I at some point you'll meet her. And then for fillers, though, I do a ton of fillers. I did under eye filler today, for example, on a patient who clearly needed it. Sometimes I don't recommend under eye filler because it could end up swelling. It could cause an issue down the line 6 months, a year later, where it could actually get displaced. But in the right patient, it could look great. So it just all depends on the right patient population. It really also depends on your patient's age, how much skin laxity there is. I've been working on a patient, she's in her 50s, and I've been dissolving her filler that she got elsewhere. It caused this malar edema over here, and we had to dissolve that, which could be a frustrating process for people. It took a lot of work to really do that, but when you do that there, it does block the lymphatic system, and then that ends up actually causing it to swell over time, and it's really, really problematic for a lot of people. What are my thoughts on GLP-1 inhibitors for non-diabetic weight loss? I think it's great. I think there's a lot of options now that people could use. It's not particularly something I'm focused on with GLP inhibitors. There's a lot of people that do it. I think part of the reason why I didn't get into it's actually kind of funny. I'll just tell you this just kind of as an aside. First of all, I think you just really should, whenever you do things, you should really do things at a very high level and just really understand that stuff. And so I try to just focus on a few different things and do that really, really well. But when it comes to GLP-1s, a lot of people are doing it and selling the stuff that they were these knockoff stuff and like these things that they were getting from compounding pharmacies only and stuff like that. And I will tell you right now, I was approached from people that were getting it, even physicians that were saying they could sell me something from overseas. They were telling me stuff that they could get it from Tijuana, stuff like that. And it's like, now the FDA cracked down on it, so it's like, that's why I just stay clear of that kind of stuff. Everyone always asks me, what about this thing? And what about like exosomes or about stem cells, things like that? There's a reason why I stay clear of all those type of things, because I know that like you really can run into a lot of problems at some point, and it's possible that you're doing something that's adulterated or whatever else, and because it wasn't really properly followed up with. Let's see here. Is PRFM better than PRP for hair loss? I didn't find it to be. I mean, my own here, I did PRFM before. I did PRP before. PRP works just as well. So I don't know why I would push PRFM on people. So I thought it was great. I do PRP on my own here. It works really, really well. Let's see here. I know I missed a few questions here. I'm going to try to hit them up though. Microneedling best for treating scars. It's probably highly ineffective for most scars. Patient today came in. She had deep ice pick scars. She had some boxcar scars. She did a bunch of microneedling sessions. She said it did almost nothing for her skin. She did it with PRP. That's not going to help you too much. I don't suggest people go down the route of microneedling with PRP for scars. I don't believe in it really. And I do so much of it. Believe me, if I was going to be able to get excellent results with microneedling PRP, I'll just do it. Like, why wouldn't I not do that? I love treating scars. I love fixing skin. Why would I not go down that route? But it doesn't work. It's just like it doesn't help enough. It's like, sure, it helps a little bit with recovery time after your procedure. Put some PRP in there, but microneedling with PRP isn't going to change much with scars. User 22 saying, can you get vascular occlusion from PRP? No, it's your own blood. So it is platelet. There are platelets there, but it's really not going to do something that's going to cause an occlusion. And I don't think I've seen any evidence of anybody ever having an occlusion with that. It's just your own platelets there. Let's see here. Talk about microchanneling. So microchanneling, I've been doing it for years and years and years. It works incredibly well. People love it. People do it multiple times actually with us a year. The same patients will just come in every few months just to do it. A lot of times what we do is we mix some Botox in there. We put some filler in there. That's mostly just for the hyaluronic acid process of things. We also put a little bit of vitamins, a lot of times like vitamin B12. Sometimes if you have like melasma, for example, we could do a dose of tranexamic acid as well, just to help with the pigmentation. So there's a few things we could do with that. And it helps really, really well for just helping overall your skin quality just look better. You're going to glow a lot more. So we call it micro gold because it just really has that gold color and we just mix it really well. Cal Ray is saying, how many sessions did you do on this patient? We did 4 sessions for this patient. This is after 4 sessions for her. And I've subsequently seen her multiple times now. And she does it basically like once or twice a year usually, just to maintain things, which is really what you should do. Let's see here. What is PRP? What are the benefits? So PRP is platelet-rich plasma. It's just full of growth factors, nutrients. That what the concept is that you could get new blood flow. So it's causing something called angiogenesis in the area. And it's a really nice concept, honestly, that I was really skeptical of early on. It was really something that orthopedic surgeons were kind of pushing, but it didn't seem to be that there was much data on it. There wasn't really much evidence for it. And then we slowly started seeing a lot more. Originally, it was a physician that was actually in Jordan who was actually doing some studies for things. And then really it was picking up a lot of other places really for hair restoration too. So I found that I was losing a little bit of hair, so it was something that I was interested in because I was like, okay, well, for that purpose, I'll try to protect my hair to make sure I don't lose more hair. And I found it was really working. Like I was getting clumps of hair in the shower, and I found that like it was just like way less. And it was like slowly it really was improving that. So what it's doing is it's really prolonging the growth phase of the hair follicle, which is really nice. So it's not necessarily causing it so that you have just growth just by itself of new follicles directly, but the follicles that you have can actually have a prolonged growth phase. And they found that there's new blood flow going there. So it's really nice for that purpose. So especially in the under eye area, it makes sense as well because a lot of times that's an area where you want to get some better blood flow there sometimes. So it's like that could work really well. Now, a test that you could do though to see if you're potentially a laser candidate for maybe like pigmentation, you could actually go and look at your under eyes and see if you have some pigmentation there. Kind of pull down your skin, just pull it down, and you can see if that pigmentation is pulling down with you. And kind of you'll see that actually. You'll see if it really is true pigmentation as you're pulling your skin. Be careful with it. Don't just like kind of like pull down like completely like that. Be careful and just pull it down a little bit, and you'll see that actually your skin actually can. You'll see that pigmentation start coming down with you, and that's a sign that probably you need to do something like the pico laser, which will help you out there. But if you're really worried about more of like the coloring of the skin, of like just like the venous discoloration of it, it's like a little bit purplish perhaps, things like that, and you don't have filler in there, or you're looking at like just crepiness of the skin area, then PRP could work really, really well. If it's true hollowness, like the patient that I had today, really it was just significantly indented there, and there's enough room there, the skin quality is otherwise good, then you just do prefer to use more filler. You want to give a little bit of volume there. And when I do filler, I do it really carefully. I'm going actually on the bone typically. And then if I need to just use another layer, I'm very, very careful as we're doing that layer so it just doesn't actually go too superficial. Let's see here. Roro is saying, what do you think of exosomes? It's something just we'll pay attention to. I know I say it every day, but the FDA had put a letter out there against using exosomes. So that's why I don't do exosomes. That's really the reason why. Can laser cause volume loss? There's not really any evidence that I've had for volume loss from laser. I think it'll be really difficult because you really have to go down and cause so much trauma to the tissue to really go down and overheat the fat pads. I'm not saying it's impossible, but there'll probably end up being a lot more complications if you do that way. Lena saying, hi, what would you recommend PRP treatment over fillers for deep mid cheek lines? That's really going to be filler at that point. You're really going to do filler for something like that. Let's see here. Bruce Wayne saying, why does my face look lopsided on pictures but not on mirrors? Good question. I mean, it's a static image, and sometimes with a mirror, you're sometimes moving and shifting a little bit and angling a bit. And that's probably why, I would suspect. But everybody has a little bit of asymmetry. You just really have to accept it. In the womb, one part of your face gets formed faster than the other side of the face. One side of your face is going to have a little bit higher cheekbone than the other side. The bone everywhere. You'll feel like the brow is a little bit higher. Every aspect is a little bit different on one side of the face compared to the other side. And even people who they claim are perfectly symmetrical will have that. So it's something just to sort of just really accept that there's going to be some asymmetry. We're not trying to shoot for full symmetry. We're trying to make it just look and appear like it's just natural and just looks great for you. But we're not trying to achieve when we do fillers just perfect symmetry because your bone structure is different on one side compared to the other side. Charlie's saying favorite treatment for scars. Well, it depends, Charlie, what kind of scars. That's the thing. It's like it all depends on what kind of scars someone has. Let's see here. Someone's saying I have a big imagination. I do have a big imagination. Let's see here. What tinted sunscreen do you recommend for oily skin, prone skin? Probably more of like a physical sunblock. Surprisingly, it's a cheap option, but you could try Neutrogena's tinted sunblock is actually pretty good for acne-prone skin. Actually, we do it a lot of times after sessions over here. Let's see here. Bruce Wayne saying, is the mirror or the phone realistic? Well, I don't think that the phone is even very realistic, because if you're using the front facing camera, sometimes it actually distorts your face as well. Go with the mirror. And like that's how kind of people are looking three-dimensionally too. Even that kind of realize that you're still looking from one angle. People don't look at somebody with one angle. They're looking at it from multiple different angles all the time. So even if you think that just that one straightforward look isn't the best look for you, it's okay, because you have multiple different angles that people are seeing, and they're seeing like the whole picture. And if you have a big smile on your face, it's okay. So you get away with a lot more then. Like it's just like you don't have to stress as much about that symmetry then. Dyra is asking, hi, how do you determine if a patient would benefit more from under eye filler or PRP? Hi Dyra, how's it going? You'll see actually an indentation right over here where it's what's called a tear trough here. Basically, you almost see the bone sometimes. And that really requires more volume. So that's going to be likely filler at that point. But if it really is more of, oh, I do have something in my teeth? Okay, thanks. I'll wash out. Thanks for telling me about that. Better? So if you do have like more like skin crepiness, then that's more of a PRP thing. That's going to help you with more PRP. And if it's like more of like a bluish color, things like that, then you potentially, if you have filler, you have to dissolve the filler. But if it's if it really is just like the vessels, then sometimes you could do PRP for that purpose. Yes, I am near San Diego. I had a patient just from San Diego just yesterday, actually. Patients all the time from there. Nick is saying, hey, so I quit vaping. What's the best way to bring my skin back to full health? Awesome. Good work that you quit vaping. Recently, I've been putting some people on anti-smoking regimen just because they want to do scars. I'm like, you got to quit your smoking first. I'm trying to drink more out of glasses, by the way. So I'm trying to do that more often. Just something I'm trying to cut back on, like just like ingesting more of that. Hold on a second. Let's see here. I have a bunch of questions here. Can Accure laser minimize pores? Yes, it could. It actually, pores a lot of times are from oil production, so it could be a little bit wider because of that. So you could actually reduce that actually with something like the Accure laser. So that's actually a really good way of doing that. Courtney's asking, what will I do to do TCA Cross at home? Definitely. So I do some of the most TCA Cross in the entire world, and I would never do TCA Cross at home. So I think you should pay attention to that. I've talked to so many people who do TCA Cross. Nobody else has done TCA Cross as much as me. Maybe there's some people though, but I never heard of anybody. So I do so much, and I wouldn't do it on myself. So just to give you an idea. So be careful with it. Like, don't do that. You could potentially cause a problem. Fortana is saying, go to sleep and get some rest. I'm actually very well rested. I'm excited. I'm energized. If you're feeling sleepy, go to, but I'm totally fine. I'm okay. I love doing this. It's actually relaxing for me too. I work all day, and like, this is fun for me just to explain stuff. Cause I sometimes think, during the consultations, things like that, it's like, I love spending time with you guys, but I know that sometimes, like when I was a patient too, it's like, sometimes there were like more questions. Sometimes there was more things I was just kind of curious about, like that, what else does this guy potentially do? Or like, what else is he going to talk about that maybe I could have spent more time on learning or something. And so it's like, I kind of wanted to be able to provide that for people. Let's see here. High cheekbones, how can I achieve it? Well, yeah, I could do that. We could do it with filler, with potentially like collagen-based products like Bellafill. That's probably one of the better options for a lot of people. But you could do Sculpture, you could do Radius, you could do hyaluronic acid filler. It just depends on what you're trying to achieve, really. Let's see. Amrita saying, what is PRP? I'm late to the party. So it's platelet-rich plasma. And basically what we do is we get your blood, we spin it around, and then we separate it to the platelet form of it, and we get the growth factors from the platelets, and we are injecting that into, let's say, for your under eye area or in your scalp, just to get some new blood flow there. So that's platelet-rich plasma there. AM is saying, I have one small acne scar indent on my forehead. Recommendations? You could just do probably a little bit of subcision, depending. I'm assuming it's meaning more like a boxcar scar. Correct me if I'm wrong. Sometimes you just do a little bit of subcision and maybe some filler there. But if it's a little thicker, you probably have to do a little bit of laser still. What about RF microneedling for acne scars? I have a whole video up there. They pulled it from one of my lives. I love talking about it because I know so many people that before they come to me have done multiple sessions of radiofrequency microneedling, things like Potenza, things like Morpheus 8, things like Vivace, all those things. I think that they're okay for skin tightening. You know, one of my patients today, he's in his mid-50s and he has a lot of skin laxity due to his scars. So someone like that, we could consider doing Morpheus 8 for the skin laxity. So what that means is there's loose skin and we're trying to tighten the skin a little bit. So something like Morpheus 8 could potentially help with that. The problem is, like in this patient's a clear candidate as well, he's got very, very thin skin otherwise. He also doesn't have much fat as well. And so if we were to do radiofrequency microneedling on him, we could potentially melt some of his fat. And it's a real concern, really. We're melting his fat, and now your scars could actually get a little bit more visible if you do that. So I wouldn't recommend doing that. I mean, I would not suggest doing radiofrequency microneedling, especially if you have scars, because you're going to have to go pretty strong to treat your scars, and it's not even going to be particularly effective, and it may actually end up melting your fat. Doesn't make much sense to me. But do it for more for skin tightening. That works. Calray is asking, does PRP quality depend on the person's health and age? I haven't seen any evidence of that, none in my own practice, nothing that I've seen printed. I'll double check though to see if there's any studies recently that's come out with that, but I haven't found that to be the case at all, to be honest with you. In fact, I should just remember, one of the patients, we actually have showed us his results before, even for his laser, we did PRP afterwards. And then he does PRP on his scalp. He's been doing it for years. First of all, his scalp is amazing. You know, his hair loss you used to have clumps and clumps of hair every time you'd rub his head, you know, to do this treatment, and you hardly have any hair loss now at this point. So it's amazing, actually. And he's, I think, 77, I want to say, somewhere around there, that age, maybe 74, but really impressive. So clearly we can improve no matter what your age is. And that's even the case with collagen. There's some like belief out there that you're not going to get collagen stimulation after a certain age. You still develop collagen. We'll still be able to trigger a collagen response. So you still could do it. You're not really too old to do these things. It's like there's ways of really doing these safely in all ages, and we could do things that could help potentially reverse aging. Neems is saying, can PRP help with hyperpigmentation for South Asian skin? I love that question. That's something that I see so often. One of my patients yesterday, she was actually a Vietnamese patient. She was told to do that PRP microneedling would help for her melasma. Really unfortunate. In fact, for her, it made things a little bit worse. So do not recommend it at all. You know, it's not going to help much at all for pigmentation, and in darker skin types or Asian patients, it could actually cause post-inflammatory hyperpigmentation. So it's really not an idea. Liz is saying, I just came back from Potenza. I just got back from Korea and got Potenza. It helped my scars tremendously. Liz, what kind of scars do you have? I'm proud that you got improvement. Awesome. What kind of scars do you have? Because I really want to see what happened with that to improve that. Smiles is saying, can you talk about the prep work needed before acne scar combination treatment, when to stop actives? Well, you're going to stop it as soon as you get our pigmentation cream. We're going to give you that, and that's going to help this process in order so that we could do this safely. So you're going to stop all actives as soon as you get your pigmentation cream. When we ship it over to you, you continue it until you get that in the mail, and then you make sure you do that. Let's see here. Liz is saying, I think I had rolling scars and ice pick scars. So rolling scars could potentially help a little bit with radiofrequency microneedling. How far out are you from the Potenza treatment, though? F is saying, how many PRP treatments do we need to reduce those wrinkles like in the picture? This particular patient, she did 4 sessions actually for that. But there is, like, Gisha is saying, not all PRP is the same. That's absolutely true. Not all PRP is the same. So the truth of the matter is that you really do want to get a high yield of platelets. That does matter. I just don't personally believe that like PRFM, PRP, there's that much of a difference at this point, at least from what I've seen, the evidence that I've seen. I used to use a lot of PRFM, never really found it to be superior to PRP. Let's see here. Liz is saying that they did Potenza treatment 2 weeks ago and she's really happy. Liz, I'm glad you're super happy. It's a little bit early to kind of say that. Even when you do lasers with me, I kind of tell people, I talk them through that you are going to have like this aspect for the first couple weeks where it's going to look amazing. Especially after the first week, it looks goals. It looks like perfect. And then you sort of like get depressed a little bit because it starts to go down and it's confusing. It's like bewildering what's going on. And you sort of like don't know what's happening over the next several months, that it's sort of shifting and changing. Sometimes it looks good, sometimes it's not as good. And what exactly is happening, that's the collagen production that starts to happen. So I do hope that you keep that results. But for the first couple of weeks, it may be a little bit off, especially with something like radiofrequency and microneedling, which does cause a little bit of swelling for about 2 weeks usually. Let's see here. Is there anything over the counter I can use to lighten my armpits, or should I try laser? Laser works really well, but you could try Eucerin's anti-pigment cream. It works well as well, so consider that. Can you explain the difference between Dysport and Jeuveau? Malik is asking the difference between Dysport and Jeuveau. So I've used all different products, all the different neurotoxins, including Jeuveau, and I found that Dysport is the best. It's just my honest assessment of everything is that Dysport's the best. And literally, I have done everything. And so it's like, for me, my patients are more satisfied. They're finding that they didn't need to do as many touch-ups in the future. That just lasts a little bit longer, maybe just 2 weeks longer, but like it's enough. And so those type of things actually seem to help out. Jeuveau, it turns out that people may have been under-treating them, things like that, which maybe that's the reason why it wasn't as effective. I personally didn't really run into problems with it, but it was something that I was hearing from a lot of other practices that they were saying that it wasn't lasting as long. To me, it was fine, but Dysport seems to last longer than that. So if that makes sense. So it's not something I'm against them, but like Dysport just seems to last longer. And that's kind of really nice for people. Like, why not just have, something that's going to last a little bit longer? Seems to be. Like, at least it feels like there's still something in there. And it's like not like where sometimes it's like these other products, it's out like immediately. And Dysport, when it's going out, sort of seems like a little bit of a slow release. So it's like a little bit nicer and softer for people. They don't have to like stress out that like suddenly they're seeing all their wrinkles or something. Let's see here. Lily's saying, if you put Belaflow in the chin on the crease, will it end up migrating? I probably wouldn't recommend doing it in the crease per se, maybe a tiny little bit, but I probably wouldn't do much there. Grace is saying, does it add volume permanently to under eye? PRP doesn't add in volume. It's going to improve the skin quality. Sometimes makes the volume appear to be better because the skin's better, but it's not actually giving volume. Jesse's saying, is hair PRP helpful for male hair loss? Okay, so I will say that really universally for all of our male patients, they've seen improvement, really. So interestingly enough, that's an interesting tidbit to be able to say. Like, I don't know across like the world offhand what the numbers are, but it's like myself, it works very, very well. I don't see clumps of hair. It's really great. Now how much improvement, it's sort of variable, but like everybody finds that like there's less hair loss, there's less of those clumps, and it's like, that's pretty good. That's like better than where it was before, and like it really stays there usually for almost a year a lot of times afterwards. So you can just do it again like that, and it's like, that's a pretty nice little perk just out of your own blood. And that's why we have like our hair program. It's super cheap. We did it on purpose that way because I just want you to do a bunch of PRP because it's really good for you. I don't push it for scars because I don't believe that it's superior for scars. Well, I do talk about for hair loss, and I think for under eyes it works good. So those are the things that's the only reason why I talk about. Let's see. Actually, I had this question by a patient today. Those thoughts on Easy PRF gel. So I used to use that particular brand. I used to use another one also for PRFM, and it was fine. I think it was good, but it wasn't anything superior in terms of overall results that I found for PRP. So, unless you have some new data or something like that that showcases that, I've actually have talked to these guys before. I never found that they had new data or anything like that that showcased head-to-head that was superior to PRP. PRP is cheaper. and we get great results. We get really, really nice results with it. We don't have to mix it with anything else. It's like, why would I not just do that? I just have people do it over and over. Why would I not do that? Like, to me, it was like I wanted it to work. I wanted like this gel to be really, really good. You could actually, I probably have, some videos where I've talked about like that it does PRFM does give like this immediate like nice glow, and it's like really nice for that. But the only difference is that over time, I'm not sure if there was much of a difference in skin improvement compared to regular PRP. It was like eventually it still was ultimately the same result. So maybe initially there was a little bit faster result, but like I don't know if it was worth that extra cost, because each kit was so pricey that you're passing it on to a patient that like without the end result being much different to me. So at least that's how I viewed it. So it's like, why kind of go about that whole thing where it's like shoot for something that's a little bit pricier that's ultimately not going to change the end result. Like, sure, I could do it. I think I even have the centrifuge, all that stuff. But like, I just never really like kind of cared to like push that then, because I was like, if it's really head to head the same and it's not really changing too much, why try to charge someone a little bit more for that then? And it makes a lot more sense also just to do something that's your own blood. It's like pure. Why not just put it in? There's a bit of a sting with it sometimes, like a tiny bit of a burn as you're doing it, but we do cool with the scalp. So as you're doing it, it's just constantly really cold and it goes really fast. So it just goes we just go. By the time you like realize what just happened there, it's cold, it's done, it's over. So it's like, okay, you can do it again next month. So that's how I view it. And it's like, okay, then you see like, 6 weeks later, 8 weeks later, you have less hair in the shower. Every time you're putting your hands through your head, you're not getting like clumps of hair. And that's actually a pretty cool thing to have. So it's like, okay, so it's a very high satisfaction. Let's see here. It's Eddie saying, hi doctor, is deep tissue subcision permanent and does it hurt? Really good question, actually. It's almost really interesting. I went overboard right there, but I'm going to go through that actually. I'm going to go through subcision. So last subject today, I'll talk a little bit about subcision. People have asked before about subcision with PRP. I talked about that yesterday too. I'll talk about that again today too. But with subcision, a patient today, so he did 3 sessions with a scar specialist that's over here in our area. He did 2 more sessions with another doctor, and then he did another session of subcision with another physician. And he was told that he probably needs more. And I went in there, and there was so much scar tissue, and it was like shocking. And he was just shocked by how like he did subcision 6 times, and there was so much scar tissue. So what does that tell us? It's obvious and clear to me that sometimes it's what people are doing is not the full true subcision. They're not really doing it in multiple different layers properly. And that's why what you're referring to is deep tissue subcision. Sometimes I'm gonna have to trace that scar and really make sure I'm breaking down every layer. I mean, I do it all the time, but sometimes I know it's just gonna be pretty much, we're gonna be constantly breaking each individual band. And it's like a lot of work to be able to do that. And usually it's blunt, but for the patient today, even though he did 6 subcisions, I do Taylor Liberator, he was shocked. I mean, with the Taylor Liberator, anybody who does it with me knows I don't do much force with it. I'm actually gently going very, very carefully. But he knew how much time I was spending on just each individual scar there was so thick, so thick, and he had done 6 subcisions before in the past. And from people who claim that they're experts at this, that they do this. One person that has even said that they've invented. I'm not talking about Dr. Taylor. He's a great guy. I'm talking about someone else who talks about how he invented this tool and this and that. But it's like the same tool a lot of other people use. And it's like this thing that he's doing, and like do the work, and like I'm looking at your work multiple times, and there's so much scar tissue still in there. And it's like it's okay, but like, at the same time, I feel like it's not really fair, because you do tell people sometimes, or these people tell people to do it multiple times, and it's an invasive procedure. Taylor Liberator is a very invasive procedure. I don't want to do that more than one time. It's like when you're doing a surgical procedure, my partner does facelifts and neck lifts. She's trying to shoot for an excellent result a single time. I'm trying to shoot for an excellent result every time I'm doing something invasive. Even with lasers, I'm trying to shoot for a really excellent result, because I know for myself too, I don't like doing things multiple times. It actually, it's not fun for me. I didn't love doing 6 Fraxels and 6 microneedling sessions. It was really annoying and frustrating when I look back at it. And I was like, I'm not doing that. When I get into this world, I'm not doing it of just like for scars. I'm not making it like I could get for certain things, you need multiple sessions of the same thing. But when it comes to scars, if you're doing the same thing over and over again, you probably just didn't do a great job the first time. And so that's what it comes down to, really. It's like you're doing the same thing over and over again for scars. And it means that you probably didn't do the right way when you did the laser, when you did subcision. And like, to me, it's like, do everything the best possible way when you have that person. I'm like Eminem, like one shot, one opportunity in life. So it's like, I just like look at this, like I got one shot, one opportunity to just do an excellent job on this person. And most of my patients come from out of state when it comes to scars. So it's like, I really am just self-motivated so that this looks so great and there's a single session for me. And like, I know that we have to do other things. I tell everybody knows when they talk to me that we're going to do multiple different other things in the future. But like, at least when you're coming to me for these sessions, I'm going to be so focused on making sure I can give you a really excellent result that it's like, that's what I'm going to make sure. And you just know it. You just know, like, when you're sitting there in front of me that it's going to happen. And let's do it. We can get there. I do wish that there's a lot of people out there that kind of push this stuff and they kind of took it more seriously, that you're doing an invasive procedure like subcision, do it really properly, or send it to somebody who does it really properly. Just consider that. And maybe like that's what needs to be done. Like, we just have to do things like and have more accountability for doing things like at a really high level every time. I know I missed a bunch of things right here tonight, but I am going to be back tomorrow. It was a little bit over tonight for me anyways, but I'll see you again tomorrow though. So same time tomorrow, guys. Thank you so much. Appreciate you. Have a